in the olden days, there was nothing like fibroid though. You knew you knew doctors every time fibroid. Please, why is it now so common that everywhere we turn to fibroid? Why?
Fibroid has always been there,
Hmm.
always. In the days of our grand, it has always been there. But
Hmm.
now there is improved diagnostic modalities. In those days, how many people they do scan? If you get belle, you are most likely to be at home. Then you get delivered at home. Who really cares? Who does scan those days? But now with improved diagnostic modalities, you now see that we begin to see it more frequently. So yes, it has always been there, but it's because of diagnosis that now make us discover it more.
What is fibroid? Because there's so many misconceptions about what fibroid is, especially when you go on the internet. People will tell you, fibroid is when a woman follow man. Fibroid is when a woman do a shower. I saw one video some time ago, I think it was last year. The guy was saying so much about fibroid and it broke my heart. So I wanted to help us break it down. For a woman listening tonight, what exactly is fibroid?
Okay, so fibroid means that the womb is growing excessively. Like, okay, not like the womb itself, but the muscles in the womb is beginning to divide more than how it should be. So it
Hmm.
now forms a growth or a swelling or a mass inside the body of the womb, how it should be, and then decide to form a swelling or a mass. And it is not due to that. Maybe when we are talking about misconception, we would maybe dwell more. But
Yeah.
it's just the fact that there is excessive growth of the muscle in the womb. So that causes swelling of the
Hmm.
womb or a mass. That's just the simple meaning of what a fibroid is. And for you to have fibroid, the first, at least you come out here first. For you to have a fibroid, it means that you have a womb. So you should first of all be glad that there is a womb. There
Hmm.
are people that don't have wombs for fibroid to grow.
What really causes this fibroid? Because we've seen comments online that if you are a woman and you eat this food, that is why you develop fibroid. If you are a woman, you take this medicine, that is why you develop fibroid. Is this linked to fibroid, or why would a woman come down with fibroid?
Um, Scientifically, we've not been able to establish what is the exact cause of fibroid.
Hmm.
We have no one can really put a hand and say, oh, this is what is causing fibroid. For instance, now if someone has cervical cancer, I can say, now this virus they cause this cancer. But for
Okay.
fibroid, there is nothing you can hold and say this is why suddenly the womb is growing, the muscles of the womb are growing,
Hmm.
themselves, growing excessively. But we know that there are some things that some of us have that we predispose us to having fibroids.
Okay.
So some
Okay.
of those first, we that are black people, that you are black, you are African, you have a higher chance of having fibroids than someone who is a Caucasian, that's someone who was or whose origin is white, UK, those Caucasian people. So we find more fibroids in black people than in white people. And what's the if you notice, if you hear the talks of fibroid, is more in our setting because even our type of fibroid that we have in Africa or in black is the very terrible one, such that at young age we can start having fibroids, unlike the so, and then some people, if their family, a member of their family, a sister, a mother, an aunt had fibroids, there is a high chance that the person will have a fibroid in her
Hmm.
reproductive time. Then also women of reproductive age are women between the ages of 15 and 49. So you are likely to develop fibroids than people that are outside that age group. Then also, a woman who had never been pregnant before, you know, some African adage will say that. a womb that has no occupant, we try to make something occupy it, and more likely it's going to be the muzzle of the womb growing excessively, saying that I
Hmm.
need an occupant. So a woman who had never been pregnant before has a higher chance of having fibroid than the person who had been pregnant
Be
before.
pregnant.
Then as we have estrogen, we have hormones, estrogens that keeps us fresh. So, and this estrogen, they have also been linked to people having fibroid. People who have this excessive estrogen, they are linked to having fibroid. And people that you find that in are
Hmm.
people who are a little of the bigger size, what we say obesity, because the fat cells, the fat in them will be breaking down, changing into those hormones. Those
Hmm.
hormones we work on the womb of the woman and make the muscle starts growing excessively. So we people who are of the big size, they are likely to develop fibroid than people who are of the slim size. Then
Hmm.
there are some people, some recently, who are beginning to see that people who don't eat a lot of fruits and fibers, like they don't dwell on vegetables, fruits, that they are also at risk. People who eat a lot of beef all the time, beef meat, because
Hmm.
this meat also, they possess some growth hormone that works on the womb and cause the womb muscles to be growing excessively. So, advocates are like women should cut down on those things and promote more vegetables and fat diet. Those are some of the reasons why people develop fibroid. But that fibroid, we can say this is a particular cause. No, you cannot. Nobody can hold anything and say this is why women have fibroid, or this is the cause of fibroid.
Okay, so based on what you said, meaning that there are other things that can increase the risk of a woman coming down with fibroid.
Definitely, definitely.
Okay, I believe you are watching this session right now. You've been able to pick one or two stuff as the cause of fibroid. Let's just address something quickly. I don't know if you came across that video. A man of God said the cause of fibroid. He said it, and the funny thing about videos like this is that they live on the internet forever. You can't
True.
pull them down. That is the problem. So I feel it's our responsibility to also put our own information out there. Is it true that a woman who sleeps with men, different men, would come down with fibroid? Number two, a virgin, because he mentioned those stuff. So also want to counter those comments. A virgin cannot develop fibroid. He also mentioned that a woman who does a shower walk, in quotes, he said that come down with fibroid. Can you help us correct that or address that?
A lot of people can say all sorts of things from wherever they are just by mere thinking about them. So they just think of things and decide to scare people away. Now, let's even start with a virgin not developing fibroid. I have operated on several nun who are virgins. We know who a nun
Hmm.
is now.
Hmm.
I've operated on several nuns for fibroids who are virgins. I'm not saying,
Hmm.
I mean several. Why? Because one thing I said just now was that non-liparity, like people who had never been pregnant, they are
Hmm.
more at risk of having fibroids because the wombs, have a theory that estrogen, progesterone, they did not rest at all. When you are pregnant, those hormones rest. That's why you are not menstruating. Those hormones sort of rest. So they didn't rest at all. They kept working on the womb, working on the womb. So I'm just using layman terms so that people
Yeah.
who are medical can understand me better. So we see fibroid in this set of people more than even the one that has been committing abortion. And we are not promoting saying all those practices, but we are just saying based on this fibroid talk. Mhm.
Hmm.
We even operate more not because their womb is resting. Their womb is not
Mm-hmm.
resting, menstruating all the time, and then
All the
she's not
time.
carrying any pregnancy. and most of them are virgins, even by their religious um, by their religious inclination and how they chose to separate themselves. When I mean nun, I mean Reverend Sister, in case some people don't know what a nun is. So we
Mm.
see even more fibroids in nun or Reverend Sisters than even the prostitutes, so to speak. So that's the first about virginity and fibroid. That's a total lie. In fact, it's almost going to be like the opposite of what he intended to say. Then in respect to if a girl is sleeping around, there is no scientifically there is no relationship between sleeping all over and developing fibroid. Sleeping all over can give you infections, can give you even you get pregnant, and so when you get pregnant you possible commit abortion, get pregnant again, commit abortion, and then that process, estrogen and progesterone, those kind of hormones, that the estrogen that really works on those muscles, they don't have the opportunity to, they rest in those periods.
Mm-hmm.
So we are not advocating that people should do that because those
Mm-hmm.
have their own risk. But I'm just trying to force him based on what we experience in clinical practice. So definitely, he was just saying that to scare people, to make them afraid, to make them afraid, and then so maybe stop their habits.
Their habits, yeah, yeah. Just
That
that this
what I
generation,
yeah.
if you saw his audacity, if you saw the way he commented, I was
I
like,
think
my
I saw
God.
the video and I was just laughing. I just kept laughing and laughing. I just said he just want to scare the ladies in his area, and then
Yeah.
those sort of things they may scare people, but then he's putting something because there are ladies there who have fibroids and they have kept themselves, and the man we not
Stigma.
trust her again because he feels that, oh, you have fibroids so you are be doing this around. Meanwhile, that's not the case. So such
Hmm.
such such people on
Comments.
with such authority shouldn't pass those comments
Those
because the
comments.
the other people will take it and start looking down on this person who have this condition. Meanwhile, that's not the kind of
True.
lifestyle this person might have lived. So
True.
unfortunately, we
True.
have a lot of them in Africa.
Thank you very much for correcting that. Let's go to the next one because of time. A woman says, Doctor, I didn't know. I just went to the hospital for something else and they checked me and discovered that I had fibroid. How come? I want you to help us break it down. How would a woman know that I have fibroid? What would she see? What are the symptoms? Oh, if I see this and this, it might just be fibroid, or there would be no sign at all.
Yes, that is the funny thing about fibroid. What we used to say that the commonest symptom of fibroid is no symptom at all. Like,
Hmm.
yes, more than 50% of women who have fibroid never know that they have fibroid. Never.
Hmm.
They don't know. They are just living their life, normally. And then maybe something else now happened and they went to hospital to do a checkup. So possibly they now did a scan for the woman and say, madam, you have some fibroids in your womb. Because majority of the time, fibroid, they give symptom, they show body. It go just dey there.
Hmm.
Dey your own, you dey your own. That's the way it operates. In
Hmm.
majority
Of
of the time, yes. But there are some symptoms that you can have when you have fibroid, which you will have to watch out for. For instance, menses is a way of where the fibroid show itself. Menstruation, when you see a change in menstruation, especially when your menses become heavier than normal, so we call that heavy menstrual bleeding. You were menstruating for 4 days before, now you notice that you are now menstruating for 6 days. You were menstruating for Someone was menstruating using 2 or 3 pads every day, but now use like 5 pads. Some women will say, I can no longer use even pad. I prefer to use pampers because it
hmm.
holds the blood, it sucks the blood more. So when you notice that, it means that there is a problem. And one of the reason for that is usually a fibroid, especially the
Okay.
fibroid that is inside the lining of the womb.
The
So
womb.
if you make this person bleed excessively.
Hmm.
Also, another that's one of the common symptoms we see or the women will come and say, that my menstruation is so heavy. So when we find out, when we check, ask some questions, we now realize that she had a fibroid. Then also you can notice that your belly is getting bigger than normal, especially on the down part where we call the panus, just that part that is between the umbilicus and the private part, that lower part of the womb or of the abdomen, that lower part of
Abdomen.
belly. So when you notice that that part is getting bigger, is, it be like the fat there don dey big, the fat there don dey thick. So
Hmm.
you will need to touch yourself and see that a growth is growing before. I'm even now saying before it gets very big and obvious. But when you notice that lower part, the fat there is getting thick, the fat there is getting thick, you touch it, it's like something is there, but you can't really make something out of it. Then you need to come for checkup, and then we can help you check and discover that there is a fibroid. Those are the common one. Then later on, you now see that some women, because of the fibroid, they may be unable to achieve pregnancy. Very few of them. That's where some of them will now come for checkup and say, "Oh, there is fibroid there." But the common thing is that many women will never know that they have fibroid. But if they have to look at, they have to check their menses, they have to check their lower part of the belly. That's more like where they will find the symptoms of
The
fibroid.
symptom of fibroid. Okay. Before I go to the next question concerning fibroid and pregnancy, I've been seeing a lot of comments. So let me just take one of them. A woman says she has fibroid, or they just discovered that she has fibroid, and now she's panicking. Ah, I will not be able to get pregnant again, oh, because I heard that if you have fibroid, you cannot get pregnant. Is that true?
It's not true. Let me first just say it categorically that it's not true. Because fibroid, just like majority of people will say, they don't even know that they have fibroid until they had something else. They have
Mm,
ulcer. They now this can say they have fibroid, and this person that is telling you that has had three children. She has had three
mm-hmm.
children, two children. She didn't even know that she had a fibroid. So because fibroid dey your own, you dey your own, most time you are unlikely to is not related to infertility. But in some cases, fibroid can make a woman not to be able to get pregnant. But majority of time, let's say, okay, I didn't even talk about a particular thing, that 1 in 5 women in Africa or have fibroid. I say one in two women in Africa, in Africa, they have fibroid. So every but let me use a bigger way to say how common fibroid is. Then you can use
Okay.
that to specify. If there are, like I use when I'm teaching my students, if there are 10 women here or 10 girls that are
Mm-hmm.
of productive age here, about 3 to 5 will have fibroid. 10 girls
Mm.
are standing, about 3 to 5 of them have fibroids. That's how common fibroid is. But about just one person will be unable to achieve pregnancy.
Out of those people that have the fibroid.
Yeah, just one out of that 5 will be unable to achieve pregnancy because of that fibroid. So fibroid, yes, can make a woman not to achieve, but majority of time fibroid does not reduce does not make you not to get pregnant. You can get pregnant, just not too far off. The patient that I remove fibroid was even came with pregnancy. Was pregnant, and we thought that she was about to deliver. We like, why are you coming to register now? She said, it's just now I noticed that my menses have stopped. Oh, with this big belly. He now say it's fibroid, so it's fibroid. So fibroid can be there and the woman will still get pregnant. Why sometimes fibroid can be there and block some certain areas of the womb,
Hmm.
so preventing the woman from getting. So the ideology that if you have fibroid, you will not get pregnant is not true. It's not true.
Hmm.
But sometimes some women, because of where the location of those fibroids are, it can prevent them from getting pregnant.
A woman has fibroid, and let's say her fibroid is now very big. But for whatever reason, she's not willing to do anything at all. She says, "No, I leave it. Leave it, my body, my choice. I don't want to touch this fibroid at all. I beg." I've heard a lot. What could possibly go wrong in the long run? A woman that has fibroid, what are those things that can happen to her if she chooses to just leave that fibroid in her system?
Yeah, there are people that will advocate that if a woman has a fibroid, she should just ignore it. I'm not that advocate. Yes, there might be some gynecologists that would say that view. Let me start
Hmm.
from there. So that's like a disclaimer. But I'm not that advocate because of
Okay. Why?
experiences. Now, if
Okay.
a woman has fibroid, first the woman should should evaluate the fibroid, like find out where is this fibroid, where are they located, is it disturbing me, is it changing my menses. You can't have a fibroid that is so big and is even as big as twins pregnancy, a full pregnancy. You say you want to leave it. I'm not an advocate of that. That's my. You can
Hmm.
have a fibroid and it's making you bleed excessively during your menses, because when you bleed excessively during your menses, you can faint. You are losing blood. That blood you are losing is not just only from your womb; it's from your body, and you are making your heart overwork more than normal. You can't have that and say you want to leave it or ignore it. No, I'm not an advocate of that. There are some fibroids that we can say, oh, madam, give am time or something. But when your fibroid is making you bleed excessively or is making you is very big, you can touch it on your pumpu. I'm an advocate that you should do something about it. You should try and remove that fibroid or do something about the fibroid. Don't like, oh, let me wait and wait. No, do something about it. That's my advocate. Now, if you don't do something about it, what can go wrong? Fibroids, you too. They are feeding them food, and as they are feeding, when they are getting bigger, it's like a baby in the womb is getting bigger, bigger, bigger. It's feeding, and then later, because it's excessively big, you are not giving, it's not getting enough nutrient. It starts what we call degenerating, like it's breaking down, it's dying. Some of them they are dying. Some of those big fibroids, they will start dying, and that will cause you a lot of pain. A lot of pain. Now, if they also grow very big, like we were saying that some fibroids, is not like fibroid cause infertility, but depending on where the location. If they grow very big, they block your tubes where the egg is supposed to pass from. They block
Hmm.
them. If they grow very big, they also block where you urinate from. That's where you see some women who have fibroid, they'll tell you they can't hold their urine again. They start running to the toilet here and every now and then. Or when they wee wee, they don't even completely wee wee, they can't completely
Empty their
empty
bladder.
themselves because the fibroid to empty their bladder effectively, and that can affect your kidneys. I have seen a woman with fibroid with kidney injury because it was so big, it started compressing on her kidneys, and that affected her kidneys. You can't have a condition that is treatable and you will say, oh, leave it, is my body, my choice. No, if you first of all seek for ideas and then do something about it. For your information, what you do about fibroid is not just operation. Operation is not, it's not every fibroid we operate. There are other things we can tell you to do them. So seek help.
Seek help. Thank you. Now, a woman wants to get herself checked for whatever reason. She doesn't know she has fibroid. So, what will be the process for her coming to the hospital? What will she go through to the point of confirming that what you now have is fibroid?
Okay, she comes to the hospital. I hope you can hear me, right?
Yes, I can hear you.
Fine. So she comes to the hospital and then she will take a card. I would prefer that in this time and age, we see specialists. You don't just walk into any hospital or just, please be specific. We are now very civilized and we know that healthcare is very important, at least good
Mhm.
life now sense. So
Good life and
you need
sense.
Yes, good like I say. So you need to be specific when you
Hmm.
go to the hospital to seek health care.
Okay.
You specify that you want to see a gynecologist, and then you'll be linked to one. So if you feel that what you have is related to your reproductive system, be specific that you, otherwise you will pass through a very long route. Like, first of all, go and see medical officer, spend some money, do this before you now land to a gynecologist. Sometimes you may be repeating investigations, tests that you would have
Investigations.
once. So when you get to the hospital, be specific that you want to see a gynecologist, so that you can express what you want, and then you take a card. The doctor sees you, ask you some certain questions concerning your menstruation, concerning your symptoms. He will evaluate you, then he will examine you. So you should know that as part of our examination for fibroid, we examine the tummy, we examine you generally, we examine your tummy, and then we examine your what we call the private part. So we sometimes people may feel it's invading their privacy, but we need to be thorough in the
Mm-hmm.
examination, be able to say yes, this is what you have. Then we order for tests. We'll have to check your blood, because if you were menstruating heavily, it can reduce your blood level. So that we need to be attended to, including your treatment for that condition. Then we'll order for a scan. Basically, a scan will be able to tell us the fibroid, what type of fibroid, where the fibroids are located, the number. The scan has a lot to say in fibroid. Why? And then this scan, if you are seeing a gynecologist, definitely he's going to request those scan with specificity. That's why you need to see a specialist, because it's not just do a pelvic scan or do an abdominal. If we suspect it's a fibroid, we'll be telling the radiologist where and what he needs to look
To
out
look
for,
for.
and not just to tell us that you have fibroids, but how many, where are they located, what's the biggest size, where possible, there are specific things we want to see them report back to us on that scan. So you'll be asked to do a scan, which we do, and based on that scan, then there are some other high-tech investigation, like MRI for high things. Let's say if there are other complications, like kidney issues, if we feel that there is a kidney problem alongside, we can ask for that test. But a scan and a blood check is usually our routine for women with fibroids.
With
So when you
fibroid.
bring that test to us, we'll now know what to do.
This woman is confirmed she has fibroid. She has heard a lot of stories that if you have fibroid, oh, you must go for operation. Oh, I don't want anybody to cut my body. I beg, I beg. What are the options for the management or the treatment for fibroid? Is it everybody that has fibroid that must go for surgery, or there are certain group of people that don't even need surgery at all?
Yes, there is. That's a very lovely questions that we need to really address when we talk about how to treat fibroids. Not all fibroids require operation.
Hmm.
There are different ways we manage fibroids, and these
Okay.
we consider a lot of things when we are treating your fibroid. We consider
Hmm.
your age. We consider whether you have completed your family, whether you have children, or
Mm-hmm.
you still want more children, or you don't have children at all. We put that into consideration. We put your symptom, what your symptom is, we put it into the consideration. We put where the fibroid is located, we put and how big the fibroids are. We put them into
Mm-hmm.
consideration when we are choosing what option we have to treat your fibroid. So there are various options. One is that sometimes there are some fibroids that we do nothing about. I said disclaimer, the advocate, that I'm not a advocate that, oh, don't do anything about.
Insane.
There are very scanty few fibroids that we say don't do anything about this fibroid. Especially, who do we choose that for? We choose that for women who have completed their family side. What I mean, you have finished giving birth, then you went to do a scan and you saw a fibroid. The fibroid is tiny, it's small. Their fibroid, they are small, they are less than 5 centimeters. And they are just on their own, they are not disturbing you. You have completed family side, they are less than 5 centimeters. We will say leave it. When you don't enter menopause, those fibroids will die off. So those set of people will say don't do anything about it. They are small, small fibroids. They are living on their own. You too, you are living on your own. You have completed your
Yeah.
family, and they are not giving you any symptoms. So leave it. When you get to menopause, those fibroids will just go. Okay. Another thing that we do is when we can give you drugs. There are drugs that we can give you. These drugs, they are to reduce they are for women who might have been bleeding excessively during their menses. Their menses is very heavy. So we give them drugs to reduce the menses. We can also give drugs to reduce the size of the fibroids. So
Mm.
they just shrink the size of the fibroid. They do not vanish the fibroids, for your information. You know, some people will say, oh, when I take this drug or the injections, some of them are injections, some of them you have to inject yourself every month concerning it. They will think that the fibroid is going to just go. So later they'll not say, ah, but the fibroid is still there. Now, no, it's just to reduce the blood loss and reduce the size of the fibroid, but the fibroid will still be there. Sometimes we give you that injection to reduce the size for us to be able to operate on you, because sometimes fibroid is so big that you are afraid that when you operate this one will bleed so much and may have complications. So you want to reduce the size first before you operate on the fibroid. So we also do that. Then we
Mm.
can also do operation. These operations that we do, some of them they are like we take you to theater, we use knife to open the person. Then there are some we use microscope, what we call laparoscopy or hysteroscopy. That's we use microscope to go into your belly and remove the fibroid. That's how beautiful some of these operation can be. They can be done easily, and then you will go home. You will not even feel like you have done something very big, because it's use of microscope we can do that. But if the fibroid is very big, nobody will use microscope to, or what we call laparoscope. That's the real term, laparoscope too. So those one we call them keyhole surgeries. Nobody will do that if the fibroid is very big. So depend on the size. Then there is also a technology wherein we use a very high, can I call it, I'm trying to use a layman term, but we call it high field, meaning that it's high frequency ultrasound scan. We use it to
Mm-hmm.
burn the fibroids. So they take you on that machine. Is I think it's only Nordica. Sorry, I'm not advertising them here, but it's only few centers in Nigeria that do that. So
Carry
they
that
use,
procedure.
yes, they carry out that procedure. They use this high ultrasound scan that has high element and target it on the fibroid without opening you up and burn the fibroid. So the fibroid shrinks and then starts falling off by itself, or the body start absorbing the rest that is remaining. So those are treatment modalities. Not everybody will do fibroid operation for. And then those are the treatment modalities that we use for our fibroids.
Okay, Ma, you mentioned surgery. I know some women
Yes.
that they've been counseled for surgery. But one thing I always come across, especially online, is if they will carry out the surgery for me, I hear that the fibroid will come back. So why should I now do the surgery? What would you have to say with regards to that?
Yes, fibroid can actually grow back. In 3% of women who have surgery,
Mm.
3% the fibroid is likely to grow back. That means if I do surgery and I remove all, because as I say, sometimes not everybody, people do fibroid that are not still specialists to hair. You know, in Nigeria, everybody they do things. So especially we try to remove all
As much.
fibroids, because
Oh.
so that they have chance. If all fibroids are removed, and let's say you do surgery for 10 women, 3 of them will have a regrowth of the fibroid. So 3% of no, that's 30. 3 of 100 people. Let me use that word. Three of
Okay,
hundred people.
three of 100 people.
100 people that you did fibroids for, they can come back to you with another growth in
Oh.
some years time. In 3 to 5 years they will come back with another growth. Now that's certain, that's true, that's a fact. So but if you don't do the surgery, the fibroid keeps growing, because when you are coming back for a regrowth, the growth is usually small and all that. But if you don't do the surgery and we say, oh, this one you need surgery for it, the fibroid keep growing, and then before you know it, it starts pressing on your liver. Most shared, the most dangerous fibroid operation I've ever done was, I was trying to remove the fibroid, the liver was pulling out alongside with me, and that scares any gynecologist. You know, the liver,
Wait,
the
wait, 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 beg, help us. Wait. You mean you were
The
trying to
fibroid
pull
was
out the
so big
fibroid?
that is it attached to the liver that is up oh, and then by the time you are trying to bring it out, it start pulling that liver. And I will tell you what we did, but at least the patient is
Wow.
alive, she's doing well. So you know, so it has its own effect, because if that gets so big, it can compress on other organs
Hmm.
and give a lot of, and it will not be good for the person, it will not be even good for the doctor that is operating on you. So
Yeah.
those are things that you need to consider when neglecting some certain conditions, you know. So if you say you don't want to do surgery, nobody usually forces you, but somehow, as I said, it's not all fibroid we do surgery for, but if we
Mm-hmm.
advise that this one is surgical, definitely it's surgical.
It's surgical. Okay. I don't know if you
Okay.
have if you've seen this. I saw one that was last year. Somebody I know. The person had fibroid, let's say 2 years ago, and said, I will not take any treatment in the hospital. There is this herb that I will drink. I'm told that this herb will melt the fibroid. To even go forward, you can see them advertising this thing on the internet. A lot of them, they advertise them. So
Yeah.
this person showed me the product. I said, sorry, I will just give you my own opinion. And then took this stuff for a very long time. I don't know if you've also come across patients too who says, I want to take herbs to melt the fibroid. Is it possible to melt fibroid? And if possible, have you seen anyone like that? And if not, what is the outcome?
Yes, we have seen a lot of them. You know, fibroid is very common, so people will want to treat it both Tayeshi and all methods. So people don't like surgery. Even the gynecologists that want to do surgery doesn't even like surgery too. It's just that it is needed to be done, and we do what is needed to be done. Now, truthfully,
Hmm.
women want to take herbal drugs to met fibroids.
Yeah.
Now, let's establish one fact. Because fibroids, there are some fibroids that can die off. You know, some people will say
Mm,
fibroid, it can't die and fail off. Yes, that's true. Some fibroids can die and fall off on your body, especially fibroids that their location is on the mouth of the womb or in the lining of the womb. It has a stalk. So those stalk, once they are not getting enough blood and they get twisted, so they can fall off and die off and then fall out of your body. So
mm,
such can happen. Now, if someone start drinking also all those herbal drugs and what, that may possibly also happen. That can also happen because those herbal drugs can contain some things that will cause degeneration of those fibroids, and some of
yeah.
those degeneration make some of them twist and fall off. But there are implications because those herbal drug also causes some things that damages the kidney, that even damage the ovaries. There was one that had this fibroid. You know, if doctors share their testimony, we know they both share testimony. If na patient, na people dey use us share testimony for church, but we know they both share our own testimony. So there was someone who was taking herbal drug, you know, because of fibroids, and then from that herbal drug, e affected the ovaries. That, oh boy, when we enter the theatre, we had to close it back and come out.
Hi.
When she showed me the herbal drug, the constituent of those herbal drugs, some of them had, yes, they could change the structure of the fibroids, but they could also affect, it's like you taking some level of chemotherapy that could also change some things inside your body, you know, affect both cells. So that's because if I what we saw, we just close and came out and said that this one pass, it pass, be careful because it don't spread, it don't, the fibroid has turned to something else, let me use that word for it. So, and because we did not take
Chai.
consent to remove her womb and she was very young, we just close and cancel her, that if she wants something like that, because the best thing was just to remove her womb, remove the ovaries and the rest part of it. So taking some things, it may cause degeneration, like death of some of those fibroids, but those also have some implications and they can affect what you are trying to prevent. You can now get something else in return.
Is there anything the lady can do and say, if I do this one, oh, me and fibroid, Otilo, you no go near me again. Is there anything like
No,
that?
no, because
Hmm.
that you are a woman, you are at risk of having fibroid. That you are a woman of between 15 and 49 years, that you are menstruating, you are at risk of having fibroid. But you can live a healthy lifestyle to reduce the chance, especially for people who do not have that family members don't have fibroids. Some, they don't have genetic relationship to fibroid. They can improve their lifestyle that can reduce the chance. For instance, we notice that women who smoke, who drink alcohol, they have increased chance of having fibroid, especially if they have a family relation that had the fibroid. So you can live an improved lifestyle, a good lifestyle in terms of no smoking, no drinking of alcohol, improve vegetable and fruit intake. It just reduces the chance. It doesn't mean
Hmm.
that, you will not have fibroid. Fibroid is very common in Nigeria and we better embrace it.
It's very common. Is my friend did fibroid surgery and she's finding it difficult to conceive. Why?
Okay, yes, quickly, Amara, I would like to say that that can be possible, and then it may not be due to the fibroid operation that she did. Ab initio, your friend may have a problem with her tubes, womb, or egg that might prevent her from getting pregnant before that surgery. That fibroid was just there occupying space, and they felt like, okay, maybe if we remove the fibroid, it can improve her chance of getting pregnant.
Hmm.
That might be the case. A second thing is that sometimes when you do fibroid surgeries and um there are complications, one of the complications can make the woman not to get pregnant. For instance, if it gets to the theater, what we gynecologists see in the theater is different, because we are seeing it. You may get there and now realize that the tubes have already been damaged by the fibroids. So even when you remove the fibroids, the tubes have been damaged already. So when that happen, you can't do anything about it. Then also the fibroid, depend on the skill of the surgeon. Some people, when they do fibroid and it's not done by a person with a requisite skill, because especially if the fibroid is very big, it's more dangerous to operate on. At that time, it has changed the body of the womb, changed the lining of the womb. Sometimes when you are now bringing it out, you bring the lining of the womb out. So you now hear some people, they finish having fibroid operation, they can no longer menstruate anymore because the lining of their womb has been torn off. So those can happen. Those are part of some complications. That's why you should not let your fibroid get so big before you start attending to it. Secondly, is that you should ensure there is a specialist that gets to get your fibroid out for you. So that's my response to that.
My sister has fibroid. She's 43 years old and she's not seeing her period again.
It can be true that it can be true if the fibroids, the fibroid may not be direct cause that why she's not seeing her period. It might be that her ovaries, because she's 43, there's what called the menopause at 45 and menopause at early as 40. So when the menopause has caught up with her, she might not be able to see her menses again. It might not be related to fibroids at all. However, some fibroids can block the mouth of the womb and make the menses not to even come out. So she'll be menstruating, and she's menstruating, but is inside her womb. It's not flowing out because the fibroid has blocked the mouth of the womb, where we call the cervix. So that can happen. But she needs to check up herself to know that it's not menopause that she has attained. It's fibroids that blocking the outlet of her womb.
So this woman says she's pregnant and she has fibroid. Will they operate on her to remove the fibroid or what? She's scared.
Okay, yes. Let me quickly address that, because I noticed that that's quite frequent now. Now, because as we said, it's not of fibroid. All it does not cause you not to get pregnant. In majority of the time, you can get pregnant and still have fibroid. So pregnancy and fibroid will just be growing together. So however, so when you are pregnant and you have fibroid, the doctor tends to manage you. Then when you are about to give birth, they check whether that fibroid is blocking where your baby needs to come out from. If the fibroid is not blocking where your baby needs to come out from, and your baby is well positioned, you will be allowed to deliver by yourself. It does not require operation. But if the fibroid is blocking where your baby needs to come out from, if the fibroid is on its own and your baby is on its own, it does not block where your baby is coming out from. Nobody, everybody wants you to deliver by yourself. When I mean by yourself now, through the vagina. That's I'm using by yourself because that's what you people might understand. Every woman delivers by herself, whether by CS or by this. But it means that you will deliver through the vagina. But if the fibroid is blocking where baby will come out from, then they will go and do operation for you. Now, when they are doing the operation, don't expect that they will remove the fibroid,
Mm-hmm.
because it is quite a bit dangerous to remove fibroid when they are operating on a baby. You might likely bleed excessively and may not recover from that. So we usually avoid removing fibroids when we are doing operation. However, if the fibroid is big and just on a stalk, we can remove the baby, secure, make sure everything is fine, then we can remove the fibroids. But originally, when we are going for that operation, we don't go with the mindset that we are going to remove your fibroid while we are operating on you. No, we are going to remove your, because it's dangerous to do so. We can do that, but it's dangerous to do so. It's good to know that it's dangerous to do so ahead of time.
Somebody says, can intramural fibroid cause miscarriage? Or she's already pregnant, but scan is saying there's multiple fibroid. Says the highest is 3.4 centimeters.
That's a small fibroid. Yeah, that's a small fiber and it's unlikely to make you get miscarriage. It's unlikely to make you get miscarriage. So relax your mind, drink water, and then drop your cup and enjoy your pregnancy. Congratulations.
Drink water, drop cup. Okay, ma, what would they what for a woman who is pregnant and has fibroid? What are those things you might want to advise her? What are those things she
Yes,
should take note of?
water. Why? Because that fibroid is likely to give you pain in pregnancy. So water,
Hmm.
what water does is that it neutralize the chemicals that those fibroid will be releasing. So it will reduce the pain that you might feel during pregnancy. So water is one key. Then fruits and vegetables to improve the nutrient status, or the small I don't know how to talk am for layman terms sha, but it improves the stuff that comes to the uterus. I no wan speak our oyibo. It's like antioxidants for those chemicals, so it sort of neutralize those chemicals. But key thing is at least 3 liters of water every day. Then don't hold back your urine. Whenever you feel like urinating, quickly expel the urine. Don't hold back the urine. And then get paracetamol always close by. So your fibroid journey, and then register with a specialist too.
Register with a specialist. Very important. I think we have come to the end of this discussion. Is there any advice you want to give African women to take note of with regards to fibroid?
Yes, I want to dismiss myths. And now, first, I want to say that our topic says blessing or a curse. Fibroid can
Yes.
also be a blessing to you. First is that you should see that you have a womb. That's why there's a fibroid there. So that's sort of a blessing.
Mm.
Women without womb but we not have fibroids. Then, secondly, fibroid is not cancer. If they give you an option between cancer and fibroid, please choose fibroid. I'm not saying that we should start advocates of saying women should have fibroid, but fibroid are not cancer. So it's better to have them than to have a cancer. So it's sort of a blessing in terms of choosing between cancer and fibroids. Then for meat, there are a lot of meats out there that is against all sorts, like drink this, drink that. If you are this, you are that. No, I want to let you know that fibroid is very common. You are not alone. So don't feel that when I have fibroids, they are very, no, a lot of women have fibroid. One in every two women in Africa, they have fibroid. That's as high as 50% in Africa of women have fibroid. And then if you have fibroids, please don't keep it to yourself. Go and seek help. Seek help. Let them evaluate you and say, oh, this fibroid is small or is big. Then there's this theory that people want to wait till they are married before they start working on their fibroid. No, you can get yourself appropriately checked up, appropriately managed, proud to even you getting married, and then the rest can just be good for you.
This person is saying, how do one know when to leave the fibroid, the one that is not harmful, and then to go for surgery? That should be between you and your specialist. You should have a
Yes.
conversation. Yeah, Elsie, You should have a conversation with your doctor. And if you listen, Dr. Essay mentioned that don't go through the long process. Just try to register to see a gynecologist as soon as possible. And why is it that some people don't like to trust their doctors? When you tell them this at the hospital, it's like the one they tell me in the market is better. Why? Why?
And they end up spending a lot by roaming around, roaming around. You spend a lot. Like I was saying, somebody that poor men spend more than rich men because they like to go round and round and round, short cut. At the end, you will combine the shortcut. I don't know why people don't. I think it's African based. Just like we trust our pastors more than intelligent people. Why? Because they say all sorts. Like that pastor now that said all sorts concerning fibroids. You can imagine.
Hmm.
So people would prefer to trust all this. And then those other people, they are sort of cheaper. For instance,
Hmm.
if I go to market, I can buy a herbal drug for 1,000 naira, 2,000 naira, and then I keep buying the herbal drug because I just have 2,000 naira at that point in time. So those are things why people may want to do all those routes. But just gather yourself together and visit a specialist, and I think you would be better for it.
Thank you very much. I want to say a very big thank you. We need to let our Oga in the house, we need to let her go. And she's very busy. Thank you so
Thank
much for your time. I really
thank
do
you.
appreciate
Good life nonsense. May we use
it. Good life in that sense.